The fluorescent lights of Mercy General Hospital buzzed overhead as 15-year-old Maya Chen pushed her wheelchair-bound grandmother through the sterile corridors. Every Tuesday evening, they made this trip for Grandma Rose's dialysis treatment, a routine that had become as familiar as breathing over the past 6 months. Maya had always been observant. Her art teacher said she had an eye for detail that most adults lack. But lately, that keen perception had become a burden. She noticed things others missed, the way certain patients waited longer for their medications, how some received smaller portions during meal service, and most troubling of all, how the night shift staff treated people who looked like her family differently. It started with small observations. Mrs. Rodriguez in room 314 complained about stomach cramps after her evening meals, but the nurses dismissed her concerns as anxiety about her condition. Mr. Park, an elderly Korean War veteran, mentioned that his food tasted strange, but was told he was just being picky. Maya's grandmother, usually stoic about her treatments, had begun refusing the complimentary snacks offered during her long dialysis sessions. "Something's wrong with the food here, Maya," Grandma Rose whispered one evening as they waited in the treatment room. "I've been getting sick every time I eat what they give us. But when I bring it up, they act like I'm imagining things." Maya frowned, adjusting her grandmother's blanket. At 15, she had learned not to dismiss her grandmother's concerns. Rose Chen had survived the Cultural Revolution and immigrated to America with nothing but determination. If she said something was wrong, it usually was. Over the next few weeks, Maya began documenting what she observed. She carried a small notebook, jotting down details that seemed insignificant to others but formed a disturbing pattern in her mind. Patients of color consistently received meals that looked different from those served to white patients: smaller portions, discolored vegetables, bread that seemed stale even from a distance. The head of evening nutrition services was a woman named Barbara Kellerman, a 40-something administrator who had worked at Mercy General for over a decade. Maya had initially found her professional demeanor reassuring, but began noticing how Mrs. Kellerman's smile never quite reached her eyes when interacting with patients like her grandmother. During one particularly long dialysis session, Maya excused herself to use the restroom and found herself lost in the hospital's maze-like basement. Following signs toward the cafeteria, she stumbled upon the food preparation area. Through a small window in the service door, she witnessed something that made her stomach drop. Mrs. Kellerman stood at a prep station with 2 other staff members, sorting meal trays into different groups. Maya watched in horrified fascination as the woman deliberately selected items that appeared spoiled or expired from one set of containers, placing them on trays marked with colored stickers. The trays with blue stickers, which Maya realized corresponded to the room numbers of minority patients, received the questionable food items. "Make sure these go to the marked rooms," Mrs. Kellerman instructed a younger staff member. "And remember, if anyone complains, it's probably just their medications affecting their taste buds." Maya's hands shook as she returned to her grandmother's side. She wanted to speak up immediately, but she knew from experience that teenagers weren't always taken seriously by hospital administration. Instead, she began building her case methodically, the way her mother had taught her to approach her school debate competitions. Her first ally came from an unexpected source. David Martinez, a night janitor who had been working at the hospital for 15 years, noticed Maya's frequent note-taking and her obvious distress during visits. Unlike other staff members who barely acknowledged the family members of patients, David made a point of greeting Maya and her grandmother warmly. "You seem troubled lately, Mija," David said one evening as he mopped near the dialysis area. "Everything okay with your abuela?" Maya hesitated, then decided to trust her instincts. She quietly shared her observations with David, showing him the patterns she had documented in her notebook. His expression grew increasingly grave as she spoke. "I've seen things too," David admitted, glancing around to ensure they weren't overheard. "Food deliveries that don't match what's supposed to be served, expired items that should have been discarded being repackaged for certain areas of the hospital. I tried to report it once, but Mrs. Kellerman said I was overstepping my duties." Together, they devised a plan. David had access to areas of the hospital that Maya couldn't reach, while Maya's regular presence during visiting hours allowed her to observe patterns that night shift workers might miss. Armed with her smartphone and David's insider knowledge, Maya began collecting concrete evidence. She photographed meal trays before they were distributed, documenting the clear differences in food quality. David provided information about delivery schedules and storage practices that violated health department regulations. The breakthrough came when David discovered Mrs. Kellerman's personal office files during his cleaning rounds. Hidden within routine administrative documents was a spreadsheet that made their worst suspicions seem conservative. The document, titled Nutrition Cost Management Protocol, contained a detailed breakdown of food distribution based on patient demographics and reimbursement categories. The spreadsheet revealed that patients covered by Medicaid or those without comprehensive insurance, who were disproportionately people of color, were systematically given expired or lower quality food items. The cost savings were redirected to ensure premium food service for patients with private insurance or those in the hospital's VIP wing. This isn't just negligence, Maya realized, staring at the evidence they had gathered. This is deliberate discrimination. She's literally poisoning people to save money and redistribute resources based on race and economic status. Maya's mother, Dr. Linda Chen, was a family physician at a different hospital across town. When Maya finally worked up the courage to share her findings, she expected skepticism or dismissal. Instead, her mother's face grew pale as she reviewed the evidence. "Maya, this is a federal civil rights violation," Dr. Chen said, her voice tight with controlled anger. "What you've documented could constitute criminal negligence, fraud, and hate crimes. We need to take this to the authorities immediately." But when they first approached hospital administration, they encountered the same dismissive attitude Maya had witnessed toward patient complaints. The chief medical officer, Dr. Harrison Webb, suggested that Maya had misinterpreted what she observed and that teenagers often jump to dramatic conclusions. Mrs. Kellerman, when confronted, maintained her professional demeanor while subtly suggesting that Maya was a troubled young woman seeking attention and that David was a disgruntled employee spreading rumors. The situation escalated when Maya's grandmother was rushed to the emergency room after consuming a hospital meal that had made her violently ill. Tests revealed food poisoning from bacteria commonly found in expired dairy products, the exact type of contaminated items Maya had documented being served to patients in her demographic group. Dr. Chen contacted both the state health department and the FBI's civil rights division. The evidence Maya and David had gathered became the foundation for a comprehensive investigation that revealed the scope of Mrs. Kellerman's scheme extended beyond just food service. The investigation uncovered financial fraud involving kickbacks from suppliers for accepting expired products, systematic overcharging of government insurance programs, and a disturbing pattern of discrimination that had resulted in numerous preventable illnesses among minority patients during the federal trial. Maya testified with the same careful attention to detail that had first revealed the conspiracy. Her notebook, filled with dates, times, and observations, became a crucial piece of evidence. David's testimony about the institutional pressure to remain silent about violations provided context for how the scheme had operated undetected for so long. Mrs. Kellerman's defense team attempted to portray the situation as cost-cutting measures necessitated by budget constraints, but the evidence of deliberate targeting based on race and economic status proved impossible to refute. The jury convicted Mrs. Kellerman on multiple federal charges, including civil rights violations, healthcare fraud, and reckless endangerment. She was sentenced to 8 years in federal prison and ordered to pay substantial restitution to affected patients. The case led to sweeping reforms in hospital food service regulations nationwide. Maya's documentation methods became a model for patient advocacy training programs, and her story was featured in medical ethics curricula across the country. David Martinez was promoted to a supervisory position in hospital operations and became a patient advocate specializing in institutional discrimination cases. He frequently spoke at healthcare conferences about the importance of empowering all hospital employees to report violations without fear of retaliation. Maya's grandmother recovered fully from her food poisoning, but the experience had transformed both of their perspectives on healthcare advocacy. They began volunteering with organizations that monitor healthcare equality and train families to recognize signs of institutional discrimination. On the first anniversary of Mrs. Kellerman's convy,